If you had hip replacement surgery or are planning to have one soon, then you're probably wondering what recovery will be like in that second week after having the procedure. In this video, I'm going to be talking about what you should expect for a normal recovery. So we'll get into the symptoms you should be experiencing, what your physical movement is going to be like, so what you can and cannot do, and what you should be doing with your surgical dressing or that bandage at the 2-week mark. I'm Matt Sigwa, a doctor of physical therapy, and I've treated hundreds of patients who had this procedure. And having a successful recovery isn't about luck, but it's all about how you tackle your physical therapy. Before we get into the video, please hit that subscribe button to support the channel and to see more videos just like this one. Now, let's get started. In week 2, your symptoms are going to change. So days 7 to 14, first off, your swelling will be decreased. In that second week, you're still going to have some amount of swelling, and even at the thigh, the knee, and possibly at the foot and ankle. However, that swelling should be much less than that first 7 days, but you can still expect to have some swelling remaining. Now, your goal is still to elevate the leg and continue icing the hip area all around the hip, just to make sure that you're managing the edema around the hip pretty good. But swelling should decrease in general. Now, your pain symptoms also should decrease in the second week, especially with standing. So when you're weight bearing while you're using your walker and going from room to room, you should notice that weight bearing, putting more of your body weight on that surgical side, is a little less painful. You should still expect some amount of pain in that hip and even maybe at the thigh when you're walking and standing, but pain levels should decrease. And with your exercises that you're performing during that first week and now getting into week 2, the discomfort level should also decrease when you're doing most of the exercises. However, you can expect to have a little bit pain remaining, but in general, your pain should decrease with standing and with exercise. That doesn't mean it's all gone, but pain levels will decrease in week 2. So for bruising, so if you're one of the individuals who did develop some sort of skin bruising at that time in the first week of surgery, then usually that'll last an additional week or two, and then it'll pretty much fade until it's all gone. In 7 to 14 days, it's very common to see that you're having a fair amount of bruising around the hip, whether that's at the thigh or more around the hip joint. But usually by that 3rd week, it's essentially gone if you're one of the individuals who did have bruising symptoms. In terms of your function, the post-op precautions, so depending on whether you had anterior approach or posterior approach, so whether they went in the front or through the back for your procedure, for your specific total hip replacement, you're going to have those precautions still in place. So those movements that your surgeon or PT told you to avoid and not perform, you're still abiding by those precautions in week 2, just to facilitate the healing and make sure that you're not putting that hip joint at risk for possible dislocation. Now, with your walking, with your standing, and getting in and out the bed, in week 2, physically, that should be easier so long as you've been working on all your exercises that you were supposed to during the first week. Now, your exercises typically get a little bit more challenging in week 2, where the focus is more of standing exercises, so working on your weight bearing through that surgical leg. So that might look like countertop exercises where your PT might have you kicking one leg out, doing some standing marching, going on your tippy toes just to strengthen different areas of your lower body, and also to get your balance and your leg used to that weight-bearing position. Now, for the assisted devices, in terms of the walker, that first week, 1 to 7 days, you're primarily using the walker just to make sure that you're taking some of the weight-bearing pressure off of that surgical leg, just so you keep the inflammation down as low as possible. In week 2, 7 to 14 days, for individuals who've met certain requirements by the PT, so some of these things can look like when you're walking with the walker, you're not limping. You're also not having increased pain when you're standing and walking. And also how you use the walker, you're not essentially using it for weight bearing purposes. You're really just using it for a little bit of balance. Those are some of the criteria and things that your PT is looking for to transition you from a walker to a cane. Now, if you're still walking with a limp, you still have painful standing positions, or whenever you're walking, you still have increased pain in that hip when you're walking. Or if you're really needed to lean on the walker, then typically you're not going to be ready to transition to the cane. But once you're deemed that you're able to do so, in week 2 is very common for a lot of hip replacement patients to transition from walker to a cane. So for the incision, at week 2, that's when typically most PTs will be removing the post-op or the waterproof dressing, so the big bandage on top of the incision, that will be removed. Every surgeon is going to have a slightly different protocol in terms of when they want that waterproof dressing, that big bandage, to be removed. But general timeline that most surgeons go by is 7 to 10 days. That waterproof dressing is removed, and then underneath that there's typically a strip, another strip of like a bandage. So that one is called like a silk dressing. So it's very similar to not a band-aid, but almost like steri strips, but essentially it's going to be a long strip that's smaller in terms of the width of that waterproof dressing, the big bandage. But the main thing is at 7 to 10 days, if your surgeon requests, then you or the PT will remove that waterproof dressing, leaving the silk dressing intact, and that will be the main bandage that you leave on, usually until the first post-op visit with the physician assistant or with the surgeon. But typically 7 to 10 days is when most surgeons want to remove that big waterproof dressing. In terms of other functions, such as getting in and out of a sitting position and also getting in and out the bed, those movements and activities should be easier as well. They may not be back to normal in terms of how fast you're doing it and using no hands at all, but what's to be expected is in week 2, you should be able to stand up from the bed or from a chair on your own without someone having to physically assist you. Now, it may be a little bit more dependent on your upper body and also the opposite leg or non-surgical leg, but your bed mobility, so getting in and out the bed, getting in and out the toilet seat or a couch, those all should be easier by week 2, and you should be essentially independent or some kind of modified version of independent, to where you're not going to rely so much more on other people for all these transfers and transitions. Now, for the individuals who have stairs in their home, just like in week 1, in week 2, we're keeping the stair ambulation, how many times you're going up or down the stairs, to essentially 0 or as minimal as possible. So if we don't have to use the stairs absolutely, then we are not going to use them, just to keep inflammation down. If you have to use them, then you have to use them, but it's recommended that in week 2, you're still trying to avoid it as much as possible. A brief overview of how to do the stairs correctly. So you're using the railing in one hand and the cane in the other hand. And the general statement is up with the good, down with the bad. So when you're going up, you want to have your hands on the railing, hands on the cane. You're going to lead with the cane always first, and then the first step is going to be with the non-surgical leg or the good leg. So you'll go up with the non-surgical, and then you'll follow with the surgical leg. And then you repeat that over and over. So you're not alternating, you just go one step at a time. Now, it's the opposite when you're going downstairs. So railing, cane, and you're going to lead with the cane, and then you're going to follow that up with the surgical leg, and then the good leg or the non-surgical leg follows, and you go one step at a time. So up with the good, down with the bad. All right, so overall, just remember that everyone heals at different timelines. So one person's week 1 and week 2 might look different from someone else's week 1 and week 2, but to best improve and facilitate your recovery so that you're doing all the right things to speed up recovery, but also prevent your recovery from slowing down. 1, make sure you're still working on your elevation and your icing. That's going to keep the pain and inflammation down as much as possible. Your exercises, there's always something that you can do every single day. Just remember that day to day, your pain level, your energy and fatigue will be up and down depending on the day. That's pretty natural and normal. after surgery within the first 2 weeks, so you can expect that. But even if you're having a down day, you still want to perform some of your exercises. You never want to go a day without doing a little bit of your exercises. And the last thing is just remember those precautions, those movements and positions that your PT and surgeon told you to avoid, because then those are the things that's really going to put you at risk of possible joint dislocation, but increasing pain and inflammation further. So as long as you're doing those things, then your recovery is going to go a lot smoother versus if you just don't pay attention to anything at all. So if you have any questions, please leave a comment down below, and I'll see you in the next video.